added to that the South Korea, Japan, Italy, and Iran as high-risk areas. So we will start looking at those travelers coming from those regions when we start doing our screening evaluations. Currently in New Jersey, we have 11 confirmed cases throughout the state. We had 6 cases, 5 new ones were identified today. And we have currently 25 persons under investigation that is being reported by the State Department of Health. At this time, we do not have any reported cases of COVID-19 in Morris County. Since COVID-19 is a newly identified virus, questions pertaining to ease of transmission, the sustainability of the virus, severity of illness, and if there are any seasonal variations pertaining to the illness require additional study. Much like the flu, we often see a decline as the warmer months approach, and today we definitely had a warmer day, which was nice. But it's still not clear if the warmer months will then help see a decline in cases. It's too soon because we don't have that much information about the virus. The public health response in the state and in Morris County will continue to be vigorous and involved with the principal aim of preventing spread and impact of the virus. To date, our office has coordinated joint conference calls with the Morris County Office of Emergency Management to update our school superintendents, police chiefs, and local Office of Emergency Management coordinators. Additionally, our public health nurse staff remains in communication with our schools and daycare providers for general inquiries and concerns as it relates to screening and monitoring. Our office is in communication with the director of Morris County Communications Center, which provides police dispatching to Mendham Police Department. We are working with them so that if we are notified of a person under investigation, an alert will go into their dispatch system, and should a call result at that address, the first responders will be alerted to wear personal protective equipment and to take precautions. This way we're protecting our first responders. We're also asking that the general public be aware of first responders donning and doffing personal protective equipment in the general public. It's not to alarm them, it's just so that we're taking extra precautions to ensure their safety as well as returning them back to their families. On Wednesday, March 4th, the House of Representatives approved $8.3 billion to respond to the public health emergency. $2.2 billion in public health funding for prevention, preparedness, and response was allocated, with $950 million to support state and local health agencies. The emergency funding requires that funds are only used to fight the coronavirus and other infectious diseases. In light of this, our health officer, Dr. Carlos Perez, had an opportunity to participate in a conference call with Congresswoman Mikey Sherrill on Friday. He had an opportunity to advocate for increased funding, resources, staffing, as well as personal protective equipment since it's in such shortage.